If you're dealing with a disc bulge at C5-C6 or C6-C7 or just neck pain in general, you know how challenging it can be to get a good night's sleep. The wrong sleeping position can increase pain and stiffness and make it even harder to heal.
Hi, I'm Dr. Frank Altenrath, and I'm a corrective care chiropractor in Cresskill, New Jersey at Valley Optimal Spine.
And in this video, I'm going to show you the best sleeping positions and tips to relieve pressure on your cervical spine, reduce discomfort, and start you on your way to healing. So let's dive in and get you sleeping better tonight. With a C5-C6 or C6-C7 bulging disc, you may experience the pain, numbness, tingling, weakness going down the arm into the hands that may be exacerbated when you're sleeping, when you wake up in the morning, and it can be quite troubling to the point where you're not even well rested anymore and you don't know what to do. So we're going to start with the basic fundamentals of a sleeping posture. So before we do that, we want to look at normal human posture. So the spine from the front should be perfectly straight when you stand straight up. From the side, there should be a slight curve in your neck, a slight curve in your mid-back, and then another curve in your low back. Cervical lordosis, thoracic kyphosis, lumbar lordosis. So the idea of having a perfect sleeping posture, if it's possible, is to maintain the normal spinal alignment, which is straight from the front and then supporting the curves from the side. So as I said, we want to maintain the normal spinal alignment as best as possible when we sleep. So again, from the front, the spine should be nice and straight. So when we lay on our side to sleep, we want to try to maintain that nice straight spinal alignment. The problem is that we use pillows. And so we can see that if we use a pillow that's too high, then if we're going to lay in this position for 6 to 8 hours a night, we're actually putting a kink in the neck to the side that where our head is on the pillow. So we're causing a lateral flexion of the spine with a pillow that's too high. If the pillow is too low, it's going to cause a reversal of a lateral flexion in the other direction. So it's optimal to have the pillow that maintains the neutrality of your spine. So why is it bad if you have a lateral flexion? Because as we can see here, if this is two vertebrae in your spine and you have a lateral flexion, so you have a lateral flexion to one side, either side, you're going to see pressure on the disc to the side that you're bending towards. And if you have a bulging disc already or you're prone to getting one, this could increase the symptoms or create problems, especially if you already have a bulging disc. So laying on your side with a lateral flexion in your neck, a kink in your neck, is going to put pressure on one side of the vertebra and causing the other side of the vertebra to push that disc out, the jelly out even more, touching that nerve, causing that pain that you feel down the arm and into the fingers. Now laying on your back is the same thing. You want to maintain the head in a neutral position with the spine. If you have too many pillows and you rest your head like this on the pillow, you're going to cause a flexion in the spinal column, which will look like this. So if you laid on your back all night with a flexion like this, that's going to be a problem, especially with neck pain or a bulging C5-C6, C6-C7 herniated disc. So we want to avoid having your head propped up over your shoulder so that your chin is flexed. I don't want to sleep with too many pillows where my head is flexed like this. And I also don't want to sleep on my side with my head kinked down because that's a lateral flexion to my right. That's going to cause an increase in pain and pain symptoms, especially with the disc bulge. So how do we accommodate this? Because different people have different shoulder heights, which means the pillows have to be different sizes. So the rule of thumb is if you have larger shoulders, you're obviously going to be further away from the table with your head. So if you're a guy with broad shoulders or a gal with broad shoulders, you're going to want to use a higher pillow when you lay on your side so your head is neutral. If you have less broad shoulders, then you're going to use less pillows so your head remains neutral. So one of the pillows that we like to use in our office and recommend to our patients is called the Denaro pillow. The reason being is that if you look at this pillow from the side, it's going to be wider on one end than on the other. So somebody who's got broader shoulders will lay with their head on this side because it's higher up and they'll keep their head neutral. And someone who doesn't have as broad a shoulder can lay on their side with their head resting here because it's narrower. Now when you lay on your back, this pillow has built into it a foam Denerol, which is a foam version of this orthotic, this neck orthotic that we use to help restore, maintain the cervical curve. In this pillow, it's not hard. It's a very soft model that's just used to support the neck in sleep. And the middle of this pillow, as you can see, you can remove the middle, so as you're laying your head over the top, your head can fall in place and really work on that curve. If it's too much, you can put the pillow back in, but it does give you the support of your neck curve, keeping it nice and neutral, keeping those curves in place as you're sleeping. So in summary, again, there's two sides of the pillow, one for broader shouldered people and one for people whose shoulders are not as broad. It's just to maintain the spine in a nice, level, straight position. You don't need the pillow to do that. You don't need the pillow to do that. You could do it just with elevating the pillows to the proper height. Remember, you're trying to maintain the spine in a neutral position, straight from the front and from the sides. You want to maintain those nice curves. So when you lay on your bed, make sure your head is not flexed too far forward. Make sure your head is not extended too far back. And from the side, you want to make sure that there's no lateral kinking in your neck. So the pillows need to match the height of your shoulders so that your spine is lying perfectly horizontal with no kinks in the neck either direction. You want to make sure that the spine is nice and level. That'll take pressure off of that spinal cord, especially with a C6, C7, C5-C6 herniated or bulging disc, or with any neck pain in general. We get our patients always complaining of what's the best way to sleep, what pillow to use. And I always tell them we offer the Denerol pillow, but we also let them know that it depends on your body size. Make sure your head is neutral, not kinked, and not flexed forward or back when you're sleeping. Keep everything nice and neutral, and that should help. So I hope those tips were helpful and that you're on your way to a better night's sleep. If you have any questions on the pillow that you saw, leave a comment down below. I can let you know where you can get one. And if you have any questions on what you heard, just leave a comment. If you liked what you saw, we'd appreciate it if you help out the channel and subscribe. Tap the notification bell so you get notified of any new content that we put out. And until our next video, we'll see you soon. Have a great day. Bye-bye.